An offhand comment that patients can often say is, "Oh, Greg, I've got one leg shorter than the other, and that's what causes my lower back pain." Having a difference in leg length can have a huge effect on your lower back and cause a lot of pain. The first thing to identify is working out exactly what's causing that. So there are two types of short leg. The first, you can have an anatomical short leg. That's where you've literally been born with a shorter leg. You can have an operation or a hip replacement where anatomically it's changed. The other reason is what's known as a functional short leg. That's where there's a twisting of the pelvis as a result of a structural change or tightening around the muscles that can cause that leg length to change. Now, typically with a functional short leg, what we look at doing is adjusting the pelvis, lengthening the muscles that are tight, and often you'll see an immediate change in that. If you're a patient of mine, you'll often notice that when you're lying flat on the table, I'll often check your leg length. I can tell a lot about what's happening in the lower back by doing that. When it comes to an anatomical short leg, if you look at this x-ray, this is a perfect example of what that can cause. In this illustration, what we have is an x-ray of a patient who's had a previous injury on one leg. And what's actually happened is anatomically that has changed. And you can see there is a huge difference in that leg length. Now, typically with an anatomical leg length, if it's more than 5 millimeters, what we can do is we can actually use a heel lift to change the height of the pelvis. And what that can do is bring a lot more stability and balance to that lower back. When we do that, what we do is we utilize different millimeter heights of heel lift, and we identify which one's going to work best for you. And often it's a progressive thing. We don't introduce a major change initially. We'll trial a certain level and then slowly work up to what we feel will be the correct alignment for you. Now, what you'll find in this is it allows the lower back to start being even, to being balanced, biomechanically can move correctly. It's just like a wheel alignment of a tire. If one tire is aligned, the other tire is shifted, it'll be the one that wears. And we want to make sure we bring balance to the hip and the sacroiliac joints through that. So hopefully this brings a bit more clarity around having a short leg, where it comes from, and what you can do to help it.